I'm Dr. Jim Werner. This is Rachel Martikovich. We're going to talk for a few minutes about a technique called teach back. Teach back is really a communication process where you really determine the patient's level of understanding about what you've talked about and what the physician has talked about with the patient by simply asking the patient to explain back to you what their understanding is so that you're sure that you're both on the same page. And we're going to demonstrate this for you in just a minute. So it's really simply what they call closing the loop in some ways. We simply call it teach back. And it's just a process of asking the patient again about their understanding of what the action plan might be, what they might have talked about with the physician, and you can use it actually at any point, not only right at the end of the visit. But if you've covered a number of things, you can even use it during the middle of your time with a patient. You're going to use it on two different occasions here when you're doing coaching, health coaching. The first will be following the patient's visit with the physician, in which you'll be in the room during that time. So what you'll do, unless the physician has already done this, the clinician has done this before they left the room, you would simply ask the patient, just so that I'm clear and you're clear, we're sort of on the same page together about what the physician was talking about, can you kind of explain to me what your understanding is of what he or she is asking you to do? So that kind of gets it out there on the table very clearly what the patient understands from the visit with the physician, okay? And if there's any ambiguity about their understanding, they're not clear on something, or they have something incorrect, if it's not really a medical matter, and it's clearly within the boundaries of your work as a health coach, you can certainly just clarify that understanding and make sure that they do understand it properly. If it's something that has to do with a medical matter that really is under the authority of the physician, then you'll want to find out from the physician themselves by going and seeing the physician, getting that clarification, and then coming back and explaining that to the patient. Okay? So you can do teach back at that point after the visit with the physician, after the physician leaves. Again, ideally the physician would do it themselves, but in case they don't, then you'll do it then. Okay? The second time that you'll do teach back is at the conclusion of your visit, your post-visit visit with the patient. So this is the health coach visit that takes place after the clinician has left the room, after the patient has had the visit with the physician. So it's important, an important tool to use to make sure that there's good understanding. We know that patients understand relatively little of what happens during healthcare visits. There's a lot of information to take in, and when it's information about your health, it also can have an emotional impact, and that also creates sometimes difficulty in really understanding and remembering what was discussed during the visit. So this is a really important way to assure that that understanding is there on the part of the patient. Okay? So we're going to do a quick demonstration of teach back.